Yes.
Ready? Okay, we're ready. Okay guys, we're doing a video here on secrets for shoulder impingement. So Stephanie's on the camera right now and she can tell you we take care of shoulder impingement all day. It's such a common problem, you know, in the workforce, athletes, you name it. But usually it's just a ton of pain right in the front or the top of the shoulder, and it might hurt to raise past here or, you know, coming across. But anyway, you know, our first instinct is to work right where the impingement is. And we do that with, you know, sometimes the tendons are damaged or the ligaments are damaged, and we'll use our tissue regenerative treatment machine, but oftentimes there's an underlying cause. So whenever you get injured, there's a muscle underneath, kind of in the armpit. It's called the subscapularis muscle, and that actually will cause more impingement, and then sometimes it even starts dragging on the nerves, so you get this really sharp nerve type pain. And if you don't release that subscapularis, this is never going to get unlocked. So, you know, when we have people on TRT, which is amazing technology, we're always working on this subscapularis. So, you know, when you have some trained hands that know where to get in there with their thumbs and whatnot and get it released, that's obviously helpful. But there are things you can do on your own, and one is with the lacrosse ball. You know, we have almost all of our patients have these lacrosse balls, and the other one's with the roller. So the lacrosse ball you can use when you have trap tightness, so you could use it up against a wall like this, just stick it like right there. And then I actually will do this sometimes because as a chiropractor I get pretty sore. So, you know, you can just roll right there. You can also do that exact same thing on the floor. And then back to the subscapularis. This is the secret, all right? This is what most people miss. You can get on the floor and do it with this lacrosse ball right there. And that can be really helpful, and that's really pinpoint. If you want to do it over a more broad area, you use these foam rollers, and then you can really put a lot of pressure with your body weight. It's actually easier to put the pressure on it using the foam roller, and you just roll till it quits hurting. So kind of a rule of thumb is if it's hurting a little bit, that's probably a contracted muscle that needs to be released. So you just stay on that. It may take a couple minutes, but those are two tricks that you can do at home, you know, that are free. That if you're starting to have some shoulder impingement, look to that subscapularis first. If you can't do it, you know, and you're not getting anywhere with it, we can definitely help you, but there's some, you know, some easy stuff. A lot of times you can resolve it on your own. So that's your trick or your tip for the day. I'm committing to do one tip from functional health, one from chiropractic, and one from weight loss every week. So we'll see how it goes. You can keep track of it, but see you tomorrow.